What's up, guys? Welcome back to another episode of the Black Professionals Project. My name is Kenton Hipsher, as you may know by now, but if you don't, I am the CEO and founder of the Black Professionals Project, and our mission is to educate and inspire Black and Brown youths through the stories and professional journeys of Black and Brown professionals. And today we have another wonderful Black professional with us, and her name is Dr. Dominique, is what I call her, but you may call her by Dr. Kagele.
You can call me Dominique.
So would you like to tell everybody, what's your profession and what industry you work in?
Yeah. So hi, everybody. My name's Dominique, and I am trained as a scientist, and that's hence the doctor part, although no one ever calls me that, except maybe you, but you're too sweet. But yeah, I'm trained as a scientist, and specifically a biologist. My areas of expertise are virology as well as blood cancers. And so, the industry that I work in is the pharmaceuticals industry. And I worked as a bench scientist for 7 years. And then after that, for several years, I worked in various marketing, business development, as well as medical affairs, clinical development, like clinical trials development roles. And now I actually work in global product strategy for a large pharmaceutical company. So global product strategy, meaning how we take drugs from the bench and bring them to patients in a safe manner. It's kind of commercial product strategy.
Gotcha. Yeah, that's really cool. I know for me, this is, and I say this every time I talk to anyone who has a scientific background, that this is a very exciting conversation for me because I could nerd out about science and stuff all day long. But I'll try to refrain for your guys' sake. I don't want to bore you all. But it's really cool just to hear some of the background stuff that you worked on and how you got to where you are today. So can you share with everybody what your ethnicity is, or how you would describe your ethnicity and where you are originally from?
Yeah. So I am a Black Latina, and, obviously we've got many other ways of saying it, including African American and Hispanic, but I call myself a Black Latina because my family is, my mom's side is American, Black American, and my dad's side is Black Latino, and specifically from Venezuela and Colombia. And that's one half, and the other half is actually Haitian. So I'm first generation American. I know it's so many words, but first generation American on my dad's side. My family speaks French and Spanish and English. So that's kind of a little bit about my kind of ethnic background. But yeah.
And then where is your hometown?
Hometown is actually Reno, Nevada. Yeah, I know. Yeah, go UNR. Wolfpack. I wasn't born there. I was actually born in Connecticut, but I grew up in Reno, so that's definitely home for me. And in fact, that's where I went to school for 10 years. I went to UNR and got my 2 bachelor's degrees and my PhD.
Wow. Yeah. School for 10 years. It sounds like a lot to the average person, I'm sure, but there is good reason behind that, you guys, and she will get to that. But I wanted to say that that's really cool because I have a friend who's from Las Vegas, so another Nevada native, and then my godmother is actually Venezuelan. So.
Oh, awesome! Yes. See, so many similarities. I mean, amongst all of us. So, for sure. So, tell the people, what a typical day in the life is for you in global product strategy, because it could
it could sound like a lot of words up front, but
right. It's like, what do all those words mean? Yeah. Yeah. So, as I kind of briefly alluded to, I used to work as a bench scientist where I was actually performing experiments, on a day-to-day basis. And so that's what I mean when I say bench scientist. And then I worked in clinical development in basically helping patients who had no other treatment options get on clinical trials in order to hopefully help them with their disease, and as well as to help the pharmaceutical or biotech company to get data to determine whether or not these products, these medicines are actually capable of helping people with their disease. So I did, like I said, I did that for probably, all of that all together, probably about 12 years. And for the past 6 months, I've actually been working in global product strategy. And so my day in life here is mainly tied to a computer, especially during times of COVID. I'm lucky in that I'm able to, do my work from home. But even outside of COVID, I'm no longer in clinical development or doing bench research. What I'm really doing is I'm in meetings where I'm working with some really talented, really intelligent individuals who love figuring out puzzles and problem solving. Obviously, coming at it from a business lens, right? But also too trying to just increase the number of patients who can feel better and live their daily lives. That's our goal, is to make patients and humans feel better. And so being in meetings with people and figuring out different ways that we can provide more benefit to patients, that's what I do on a day-to-day basis.
Interesting. That's cool, because you kind of have your hands directly on the patient, but not at the same time. You're making a lot of those decisions behind the scenes that is directly affecting patients.
Yeah.
And that's a really cool aspect of it, because it's kind of like you're getting the satisfaction of, bettering someone's quality of life, but you're not necessarily holding their life in your hands at all times, like maybe a surgeon would, or someone of that sort.
Absolutely. Absolutely. And I'm not a clinician, I'm a scientist by training. And so exactly what you said, the main reason why I went into science as a career is not only because I love science, but also too because I wanted to help people. I knew that I didn't want to be a physician, mainly because I'm really squeamish. But I always wanted to use my, science to help people. And so you're exactly right. I'm able to help people indirectly, with my work. And that is so humbling and absolutely rewarding.
Mm-hmm. So how did you get started down this path? Because this, like you said, there was 10 years of school. There's been, multiple jobs in between where you started and where you are now. So what has that process been like for you? Were you enrolled in any high school programs that were catered towards things like this? Or, what was your college time like? Kind of share a little bit about that.
For sure. So I'll say that at a very young age, I knew I was interested in science. And my dad had gone to school for biochemistry, actually. And so he had biochemistry, anatomy and physiology, microbiology books. And so I would read them. I would read them as a kid. And I was super dorky, but I loved it. And then I went to a high school that was really focused on science. And so I think in my 4 years of high school, I took 6 years of sciences, and then went to college and got my bachelor's in biology, got my bachelor's in biochemistry, and then again, like I said, my PhD. In the middle there, I thought that I actually wanted to be a pharmacist. So I worked in pharmacy for about 5 years. And, for me, it's obviously a fantastic career. But I really wanted to be able to ask questions and then test them, which is exactly what a scientist does. And so that's why I went to grad school. And so that was school up until then, because I actually went to school for 3 years, and I just graduated and got my MBA. So I've actually been in school for a total of 13 years. So too many years. But to get back to your question about what led me to that, I really, like I said, I really just was super passionate about science and being able to and trying to apply that to help people. And my high school definitely influenced that. Working in pharmacies certainly influenced that as well, because it gave me the ability to interact with healthcare providers as well as patients. And then working closely with physicians to identify what treatment options are available and which treatment options are not available for their patients, who are still suffering from these chronic illnesses. And so kind of all of that together has kind of shaped me and where I am today.
Wow. That's quite the journey for sure. No, it sounds very, very education heavy, but I think yes. the underlying key there is not education for the sake of education. It's education with a purpose. You had an idea of what your goal was and what your passion was, and you found that path to get there and you followed it. And even when it didn't work out, you shifted and went somewhere else. So learning to pivot, very key, guys. Learn to pivot.
Absolutely. And I think you're absolutely right. This is something I actually tell my kids is, being smart is one thing, going to school is another thing. And, hopefully you do both of those things, right? Or are both of those things, educated. But then, don't stop there. You have to learn how to apply it and, figure out what makes you get up at, every day. And how is it that you can help other people? Or at least, for me, I'm super, passionate about helping people. And so, how can I turn what I've learned into something that delivers value and helps people?
Mm-hmm. Definitely. That's a great transition, actually, to figure out, what are the things that excite you about your role? What gets you up out of bed every morning and makes you go like, I'm going to tackle some global product strategy today?
Yes. Well, I will say that it's something that obviously that I've been saying many times now is the ability to help patients in a different, maybe unconventional way. And I say unconventional for the fact being that there aren't as many scientists, who kind of take this path that I'm in right now. However, with that being said, what really attracted me to this and what really gets me excited is the challenge. It is, like I said, it's like a jigsaw puzzle, and there are, multiple factors and, different variables and parameters that we're all trying to figure out. And how do they fit together? How can we put this puzzle together again to deliver the most value that we can to humanity? And so, that problem solving, I love it. Maybe that's why I became a scientist, is again, problem solving. This is my job, is problem solving, working with really smart people and just constantly learning. And I've always been, just so curious as an individual. And so again, having that opportunity to see where there's an unmet need in patients and figuring out how is it that we can help them, working with really smart people, all of these things, together are what excite me in my day-to-day.
Problem solving is really at the core of so many different areas in life. I mean, I went to primarily engineering, but overall STEM school, and problem solving is everything for us. Like there's nothing else that you will learn coming out of that school better than how to identify and solve a problem. That's
absolutely. And well, and that's why scientists and engineers, think so similarly, right? Because we might approach it in different ways, right? But it's still ultimately the same thing. It's like, okay, trying to figure out how to fix a problem, or to solve a problem.
Exactly.
Or get from point A to point B, right? So.
Exactly. And oftentimes, like you said, we're trying to do the same thing, but we just come at it from different angles. Scientists, we may think about what's possible. Theoretically, what can we do here? And what have we seen? And how do we test it? And engineers may be thinking about it and how can we apply whatever the scientists come up with to make it real world feasible. And so, like you said, solving the same problem, just coming at it from different angles. And that's super key, really, in anything, because, there's multiple levels of understanding a topic. And I think the highest level is being able to teach somebody, because you can understand how to solve something in a variety of ways.
Absolutely. Completely agree.
And I'm sure you see that too, being a mom, having to teach your kids stuff all the time. They may not get it the way you think about it in your head, but you have to learn to, see it from a different angle and try to show them something new.
Certainly. And, there are things that there have been so many times where I've been humbled as a mom, learning from my kids, because they have, they are just so young, and they haven't seen the world yet, right? And so when they come at it from their perspective, or they ask a question, why is this way, why is XYZ this way, and I'm like, that's a really good question, because I've always just kind of taken that as fact, but you're absolutely right. There are other ways that we can approach this or solve this, or, yeah, you're right, this doesn't make sense. So, yeah, always learning. And that's, the humbling, but really good part about being a human being, and, surrounding yourself with people, all different kinds of people, because we can all learn from each other, including me from my 10-year-old and my 6-year-old. So
life lesson right there, guys. Yes. Never stop learning.
Never stop learning. Absolutely.
So, although you have all these great, exciting things and, solving these puzzles in your day-to-day life, or your day-to-day professional life, I should say, what are some of the obstacles that you faced in your role and that you continue to face even?
Yeah. Well, I will rephrase the question a little and say and talk about the obstacles and hurdles that I've faced as a Black woman who is highly interested in science and medicine, growing up and up until the point where I am now. And then, how I've taken those experiences and kind of shaped, how I interact with my colleagues, and how I view my life mission almost in my role today. So growing up, obviously, growing up in Reno at that time meant that I was one of few Black people who grew up in predominantly white neighborhoods. And then I went to a high school where I was one of 13 Black people. And so I, definitely stood out there. I was also 2 years younger than anyone in my class. So I definitely was just definitely different, and had to learn how to, I wouldn't say blend in, but try to become not intimidating, as someone who doesn't look like everybody else, and learn how to put people at ease when they're talking to me. And so that's definitely a skill actually that I use I think it's inherent almost in me now. Just being able to relate to people and make people feel at ease. And I think that's something that we can use no matter what our color of skin is or anything like that, is learning how to relate to people. But growing up in high school, I was told that, I probably wouldn't be good enough to get into Harvard or go to, become a scientist or be a doctor or a pharmacist or go into a healthcare field. And I was told that multiple times. But the thing is that, none of these people that told me these things, they don't know me well enough to know that if someone challenges me, if somebody says something like that to me, then I just take it as a challenge just to prove them wrong. So people, keep on saying these kinds of things because then I just eat it up because I'm like, I'm going to
really the girl who was reading the biochemistry textbooks as a child.
It's whatever. So anyhow, but and so that was in school, that was in college even too, especially amongst some of my well-meaning and well-intentioned white friends where they just didn't, they don't see any Black people, in these kinds of professions. And, it's like, oh, you really want to do that? Oh, then why don't you try being a nurse? And not to say anything bad about that, but no, that's not what I want to do. I said, I want to do this. And, why are you trying to discourage me from what, I want to do? Right. And so anyhow, so I experienced a lot of that. And then during my professional career, and as I was transitioning out of, academic training as a postdoctoral fellow in Utah, again, very predominantly white neighborhood, or not neighborhood, but just state in general.
Yes.
And again, nothing bad about that, but I certainly was one of the only Black people around. And it was intense. That was one of the most intense times in my life where constantly felt scrutinized, constantly felt like anything I said was not as good as somebody, some of my white colleagues. And consequently, when you continue to feel that and hear that, even if you try your hardest not to believe it, some of it sinks in and it starts playing on you mentally. It really does. And I can remember sitting in meetings where I would have a question or I would think of something and I would intentionally hold it back because I'm like, oh, that's not a good question. Oh, everybody knows that already. Why, that's a silly question. I'm not gonna ask that question because everybody else in this room knows that but me. And then somebody else would go and ask that question, or even a professor would ask that question, and I would kick myself every time. I'm like, man, I was right on track. Why didn't I just say it? And it's because a part of me did believe I'm not good enough. I'm not as smart as these people. Even if I didn't tell myself that, and even if I didn't think I believed it, I did in a way, right? And so that was a very intense 3 years. And then I moved into industry where for several years I felt just the exact same thing, essentially. Intentionally left out of meetings, tried to be placed in a box and, kept separate, even though my role was in a business role in a business strategy. Lots of that happening, again, intense scrutiny, and then questioning, am I good enough? But then luckily, thankfully, I had several people who identified or saw in me something that made them say, she's got talent, or she has this passion, she has this drive, she has the motivation. And so they mentored me, they sponsored me, they gave, they put my name up for stretch projects, and so these sponsors within the organization were key in helping me to get to the next level, because you don't know what you don't know until somebody kind of exposes you. And I am forever grateful for those people. And in fact, I still talk to, still have good relationships, close relationships, I should say, with many of them. And so that's kind of what gave me the ability to slowly start breaking out of that mindset of like, I really like this, but I'm not good enough. I'm not smart enough to do that, and little by little, those bricks were knocked down, by those people. They helped me to see that, and just continuing to work hard and to do that internal work of, I am valued, I'm valuable. What I have to say is important, just as important as everybody else. And yeah, you damn right, I am as smart as, any of these people. Not to say that I'm the smartest in the room, because as my mom always said, there's always going to be somebody prettier than you. There's always going to be somebody richer than you. There's always going to be somebody smarter than you, right?
Of course.
Right? But I'm intelligent enough to do this, and I have the passion, and I'm willing to work hard. What's stopping me? And so again, that's a process. And even to this day, I'm doing the work, right? It's not an everyday thing where I feel super confident. There are days where, I feel like, I messed up there. But, I could have done that better. But I think that's any one of us. So, yeah. And then what I'm doing today, bringing all of those experiences up to current situation, I am in a role where I feel completely supported and completely empowered. And part of my mission, in addition to helping bring medicines to patients, to bring, real value to their lives, their quality of life, as you mentioned, but also to help break down those barriers within our organizations to have more women of color, more Black men of color, not only for our communities of color, right? To show them that, hey, if this girl can, who came from nothing can do this, so can I, right? Because I literally didn't, my parents didn't have a whole bunch of money. We didn't. But I'm here today because of opportunities that were given to me, and because of hard work, right? And because of that drive and that passion. And anybody, those are the key things, right? And anybody can do that, but they need to be provided those opportunities. So that's one side. And the other side is to show, the white majority, that there is tremendous value in having people who don't look like you have a seat at the table, right? And who are in decision-making roles to enable, again, just a greater and better society for one another.
I couldn't have said it any better myself, really. I know, just thinking about what you were saying, it really resonated with me, just because self-confidence is something that's no one's born with self-confidence. Like, it's something you have to earn every single day. And I think one thing that one of my mentors told me before, and something that I'm always implementing, that you sort of alluded to, was, be confident enough to tell people when you do something right, when you win, when you succeed. Because a lot of the times we may belittle our own actions, but our coworker next to us may have done the same job. And because they said something about it, they're the person who gets the raise. They're the person who gets the new opportunity. And you really do have to have that confidence to stand in what you do. And when you win, know that you've won. And that's okay. It's okay to be successful. It's okay to be great.
I love that. It's okay to be great. And a lot of times I struggle with that. Even still, it's okay to be great, and it's okay to acknowledge it. But more than anything, it's okay to acknowledge the hard work and the opportunities. And for me, I'm religious, the blessings that have been given to me to enable that, that success, because, it didn't just show up.
Of course.
And so, it's a combination of all those things, but I absolutely agree with you. And I agree, just to put a final point on what you said about being confident in yourself and your achievements, also be your advocate, be your own advocate. And, you know, and don't be afraid of advocating for yourself or sticking up for yourself, essentially, when, you know, if and when the time comes.
Yes, because no one else is going to do it. No one else is going to do that for you but you. And it's really key to get that into your head and really just, if you have to tell yourself daily, you know, I am successful and I will be successful and I will continue to be successful in the future. And if you can keep telling yourself that, you know, your actions will follow, but you have to get your mind there first. And sometimes that's hard, especially for people, I think, like you and me, who, you know, we didn't come from a lot, but we did have something.
Yes.
And, you know, that story alone is one that's not told very often because it's not catching. It doesn't grab people's attention. It's not like the LeBron story of, you know, a single mother, you know, one child having to grow up and become this superstar legend, or it's not somebody who was the son of Bill Gates and has all this money and now is doing great things. It's the forgotten story. And because it's the forgotten story, we often, I think, belittle ourselves and our accomplishments. So remembering that, you know, you had to earn what you have now. And it's really key for you to live in that success and be happy with that.
Absolutely. And more than anything, be grateful for it. Because, even though it's earned, it's certainly, you know, nothing in life is guaranteed, right? And we just have to be grateful and cognizant of that. So
talk about it. Tell them.
Yep.
So, you know, even though there are obstacles and there is a lot of things that you have to face on a day-to-day basis, and of course you are being successful and you're thriving through those challenges, what would you say is one misconception that someone may have about your career and what you do?
Oh, that's a really good question. One common misconception about my career, well, oh gosh, I guess maybe something that I had said earlier about scientists kind of all being doing, you know, the mad scientists, you know, you can picture them in their lab coat. And you know, I never really understood what a scientist was growing up. I just knew that I liked science. But then obviously through graduate school and my postdoc, I learned what a scientist was, you know, because you know, it's like, I have a hypothesis, I have a, you know, and for those, you know, maybe might have littler ones watching, a hypothesis is an idea you think, you know, that might be true. And so, you know, you might say that, you know, I think the grass is green for this reason. And so then what you do is you go and perform experiments to figure out if your hypothesis is true or not. And so I didn't really know exactly what that was, you know, that's science, right? And, you know, becoming a scientist, doing that, doing bench work for 7 years, I never really saw outside of, you know, science, the application of science outside of the bench. However, as like I've told you before, I've chosen a path that has enabled me to bring my kind of scientist thinking cap, you know, or basically the lens that I view things, because that's how I've been trained. And being able to apply that in a business setting and being able to leverage both of those things, you know, the business part of the industry that I work in, and then the science and the clinical aspect for not only the molecules, but also for the patients and their diseases. How do we bring those two together? And so I think one of the misconceptions is that scientists are only doing experiments, but that's actually not true. You know, you can have a very fulfilling and rewarding career outside of the bench. For me, at least, it's been that way.
Hey, I had the same experience, and I'm a living representation that you can do more than be on a bench squirting stuff into tubes, as it was once said to me.
Right.
So as we wrap up here,
but that's fun. That's fun. Don't get me wrong. And sometimes I miss it. But I do. I love what I do, and so forever grateful for all of those experiences. But my hat's off to those people who continue to do research, because that's one thankless job. It's a lot of hard work and iterations and many failed experiments
yes,
to get the one that works well. So, yeah,
it's a lot of hard work. Like you said, thankless job, but it's a very important one, and one that is much needed in our society.
Absolutely.
So as we wrap up here, are there any closing pieces of advice that you would like to give young Black and brown youths out there that may want to follow in your footsteps or pursue a career that's similar to yours?
Absolutely. One thing that two things is always believe in yourself, and always think about, try to figure out what makes you really super excited, about something that you want to do. And usually there you can kind of find your passion. What is it that you like to do on your own free time, that no one has to tell you to do it, and you still are just attracted to it and you're drawn to it? Find out what that passion is, and just pursue that relentlessly. And the second part of that is pursue that relentlessly, despite whatever anyone says. So whether it be people who you don't know, or people who are close to you, including family, basically find your path, and then just go and pursue that. So that's the first word of advice for anyone who's watching this, any of our youth. And then the second is really don't be afraid to ask questions. It's totally okay not to know everything. For the longest time, I thought that if I didn't know something, then I was stupid, or, I felt super embarrassed. And
grad school guilt.
Yes, absolutely. Ask questions, because and actually you learn so much more when you just ask questions. Now, eventually you have to start saying something too, right? But don't be afraid to ask questions. Don't be afraid to say, hey, I don't know a lot about that. Tell me more, or, again, you that will open you up to so many experiences, and just so much, the wealth of information that I had mentioned before from people all around us. You don't know until you ask, and it's okay to not know everything. Even as educated as I am with so much schooling, I still, in my job every day, I'm like, okay, I don't know enough about this, or even in an area where I think I know a lot. I'm always impressed by another element that I don't know. So don't be afraid to ask questions.
There you go. You guys heard it right there. More nuggets of wisdom from the doctor herself. And once again, we want to thank you for coming onto the platform. We really appreciate you being open and vulnerable and sharing your professional journey with us. At this time, are there any shout outs that you want to give? Shout out to the moms or anybody like that.
Yes. Well, first of all, I'm going to say, obviously, a big shout out to my parents, because without them and, their relentless hard work, I would not be where I am today. And their persistent encouragement and just love for me has been incredible. And so my parents, for sure. Obviously my two kids, but the single mamas out there, big props to us. Okay. So yeah, that's my shout outs. And then obviously to all the Black men out there who are rocking it, and all the Black men who are growing up and following in the footsteps of of talented and intelligent, powerful, strong Black men like you, Kenton. Again, props to all of my beautiful Black kings out there too. So that's all I have to say.
Awesome. Well, thank you again. I appreciate it. And kudos to you, as the single Black mother out there killing it. And with that, I look to the camera as I always do and remind you guys to like, comment, and subscribe to the channel so you never miss an episode, and always hear these Black professional stories so that we can help educate you guys and make you aware of what's out there, because there's so many careers out there available to you, but you just may not be in the loop. And so we're trying to pull you into the loop and provide you an opportunity to see faces that look just like yours and be encouraged to know that you too can do it if these people have done it already. And so with that, it's been another great episode of the #Black Professionals Project. And we will see you guys next week. As always, on Monday, make sure you tune in to see the next episode. See ya.